I grew up in a really small town in far northern California. My parents were really instrumental in guiding who I am as an adult. We didn't have a lot, but they instilled a work ethic in me, and that's something that's carried over. They also instilled the importance of being honest and direct. Ultimately, I moved around, went to medical school out in Nashville, Tennessee at Vanderbilt, did my residency at Stanford, moved around with my wife to Southern California, and have now been in Boise in practice with Dr. Slater, who's been a wonderful partner to work with at the Idaho Center for Reproductive Medicine. During that time, my wife and I also struggled with problems with fertility, and I think, like with most couples, we had just attributed it. We had busy lives, we were both professionals, and so it's like maybe we just weren't putting enough effort into it. But at some point, I think, like a lot of patients, you begin to realize, maybe there's something more going on than just not being able to put the time or focus on it. And so it was actually while I was in training, we went to have a fertility evaluation because it had been probably about 4 years. And that's when we realized that we had a pretty significant problem. We ultimately went through about 6 cycles of IVF. We ourselves didn't have success. And we looked at other options, had discussed between the two of us as a couple what seemed right to us. And we decided to move forward with using an egg donor. And I can tell you from our perspective, we have 0 regrets. We now have a son who's 1 year old, and he's been the light of our lives. And I don't think there's words that can express how grateful for us that this type of technology exists, that this type of opportunity is out there for patients. So even, I think for us, we'd like to convey, even for patients that have some of the most difficult fertility problems to work with, there's hope and there's still opportunities. So, I think it's important to reach out when there is a problem. There's no obligation, you're never going to be forced into anything you don't feel comfortable with. But a lot of times there are options and different ways to help people build families. Sometimes it can be very relatively kind of inexpensive treatments, a lot less aggressive, but even in cases where there are really difficult medical problems, there are ways for people to help build their families. My name's Kevin Maas. I'm one of the physicians in the office. I am trained in reproductive endocrinology and infertility, and work with Dr. Slater as a partner in the practice.
I'm very fortunate to have Dr. Maas. We were both raised in small towns. We both went to our fellowship and our residency in California. And the most important thing I think about this whole situation is that it's people-oriented. I'm very lucky to have Dr. Maas, and my clinic is with good people. Dr. Maas, Dr. Courtney, we care about the people and we have good service.
Dr. Maas is incredible. He has probably one of the biggest music obsessions I've ever seen, and he loves to play a game with me when we're doing our chart reviews on identifying artists, and I am totally the girl who listens to the radio, so I pretty much never get it right, but he's always teaching me that, and he really loves to sit and talk about the process, and if there's something I don't understand, or even how the hormones shift and why this works and why this wouldn't work. He really likes to continue to learn and try new things and try new protocols and be as cutting edge as he can, and he really loves to make sure to teach his patients, and that's something I've learned from both of the doctors, is an informed patient is the best patient, and we don't want our patients to ever feel like yeah, whatever, that we're here to help you understand the process from start to finish and answer questions, and we want you to know that we want our patients to know that we are involved in the process and we're here for them, and this is a scary process and it's a lot of information and sometimes it's across a language, and so no matter how long it takes, both doctors and myself will sit with the patient for as long as it takes to make sure they understand and are comfortable with the process.